So I know we've done this before, but still, like, can you introduce yourself for the audience?
Yeah, for sure. So my name's Keegan. I'm a performance specialist and a physical therapist at Exos in Phoenix, Arizona. So with that, my role is kind of split between those two fields. I spend time rehabbing athletes from injury, but also like improving performance with athletes for different groups. Specifically, I run our NBA offseason and NBA programs, as well as our NFL combine weight room.
So since you're a physical therapist and also a performance coach, have you ever had the chance to like train the same athlete and after the training session, like doing the like physical treatment with the same athlete?
Yeah. So that's what's cool is like, especially at a place like Exos, my role kind of evolves across the year and with different situations. So yeah, there's definitely been a few times when I'm managing A to Z, somebody will have some injury things that are going on. I need to manage that from a therapy perspective, but then also I'm managing all of the performance aspects as well. So it's definitely fun, but also you start to see like it's really the same thing. You're just applying stress and you just have a slightly different context and things to consider, but it's pretty much the same.
Cool, man. Cool. So I've noticed that Exos like held a education for all those who work at Exos but not in the state, right?
Yeah. We just had our like internal summit. That's right.
How is that going on for you?
Yeah, so we've done that a few years now. It's always good to get like the whole company together and just like, actually get to interact with people within the company from other areas. And it's always nice just to learn together. So it's always good.
Cool. So one of my friends actually just went there and come back to Taiwan.
Sorry, cut out there real quick. Say that again.
One of my friends just like just went to Exos, Arizona, and just came back to Taiwan like a few weeks ago, I think.
Oh, no way. That's awesome.
And he actually really enjoyed that.
Was it for the mentorship or was it for the internal summit?
He's for the internal summit, but I think
Nice.
the content is like the phase 1 mentorship, right?
It just kind of depends. Like they'll have different topics throughout the internal summit. So
cool. So today I kind of want to ask is like how to like train athletes to jump higher and some of like the tendon stuff. Okay.
Yeah, that sounds great.
So first of all, like in order to train our athlete to like jump higher, is just like what should we be focusing on? Like strength, plyo, or anything else?
Yeah, so I think you're definitely going to have a wide range of needs across athletes, right? Like some athletes may be super springy and really twitchy and not have as much horsepower, whereas other athletes might be really strong and lack a little bit of that twitch or that bounce. And so they need a little bit more plyos. And then you might even have a whole another category that just need a little bit of like body comp interventions, and those sides of things. So I think really it just comes down to getting a good evaluation and then being intentional about the buckets that are the weakest areas for those athletes. So, a specific thing you could look at would be something like a eccentric utilization ratio and just look at a counter movement versus a squat jump and figure out how well they can use a stretch shortening cycle. And so, I've seen anywhere from, 20 to 30% range on what you should expect with a counter movement. And so if you do a counter movement jump and then look at their squat jump and it's not a 20% or 30% difference, then that kind of gives you some insight on where they need to improve. Either they just have a really poor squat jump and so the ratio is crazy high and they just need to get stronger because the squat jump is so poor, or you might find something that's in that 20 to 30% range and they're using a stretch shortening cycle well, and you don't necessarily need more plyos, but you just need to kind of continue doing what you've been doing because they're using that effectively.
Cool. So if I know that if there's like athlete or like younger guys, they want to like jump higher, they're gonna be jumping a lot, jumping all day long. So for those guys, uh, if if I really want to like introduce plyo for them, how would you like program it?
Yeah. So, I mean, obviously, if the goal is to jump higher, you also gonna have to try jumping higher and like measure that somehow, right? And make it competitive for the athlete and engage them a little bit. But in terms of like introducing it to them, I think there's a lot of talk around like strength standards, but we have to like step back and think about like what plyos really are. And even from a young age, like people are doing plyometrics with sporting activities, so despite their training age in the weight room. So I think really what you have to consider is just like what they're getting elsewhere. Like if they are in sport doing practice, they're getting a lot of plyo or velocity type stimulus. And so is adding more to that going to really move the needle, or do you need to maybe emphasize something else somewhere else? But, if it is plyos that you want to kind of focus on and program for, there's a few different variables and things to consider around like actual things in terms of programming, like the type of plyo. Are you going to do a jump, 2 legs to 2 legs? You're going to do bounds, 1 leg to the other leg? You're going to do hops where it's 1 leg to the same leg? What direction do you want to go? Straight ahead, sideways, vertical, horizontal? Do you want it to be really high amplitudes, things from a box, or low amplitudes like to a box? Does it need to be loaded with external load, or is it unloading the body weight to try to make it go faster with like bands and things? And then also considering just like the ground contact time that you want to get out of it. Is it, a pretty fast, really short ground contact time, or is it just like absolutely jump as high as you can, regardless of the strategy that you use? So, there's a lot of different buckets to consider. And I think we at Exos often try to line up our days in terms of like linear and linear emphasized plyos versus lateral and lateral emphasized plyos. But it just depends on the training frequency, the availability of the athlete, how much time do you have with them. And so all of those things are going to play a role into what you actually end up doing plyo wise.
Cool. So I know there's like different different kind of like, how do I say this? Different types of like strength qualities, like max strength and like strength speed, speed strength, and max speed, right? So when we program these like strength exercise, let's say like squat or like hex bar deadlift, how to like pair these with let's say like plyo or like speed.
Yeah, that's a great question. So, I mean, I think you'll see a lot of different contrasting things out there. But I think one way I kind of think about it that I learned from a good friend and mentor, John Barlow, is like just considering the force velocity curve and like where you want the stimulus to be. Do you want it to be velocity based? Do you want it to be strength based? Or do you want it to be somewhere in between where it's maybe more of a speed but slightly heavier, speed strength? Or again, trying to bias something relatively heavy but moving it fast for like strength speed. So I think oftentimes I'll try to just prioritize where I'm at on the curve based on the needs of the athlete. If an athlete is coming to me and being like, hey, in the last month, I've spent a ton of time sprinting and playing sports and not a lot of time over here in the strength realm, then maybe they don't really need a ton of like velocity based things, and they need to stay away from that. But maybe there's the exact opposite. Somebody's been lifting all the time, but they haven't been doing any plyos or sprinting or fast-based things. I need to bias a little bit more speed-based stimulus for their goals. So I really try to be intentional with how we're splitting that up. But in terms of like an actual contrast and superset, a couple of things that I like would be like a mid-thigh iso pull or some sort of isometric is always really nice, paired with something really fast, or some sort of like really heavy, more strength side of the curve movement, whether it be like a trap bar deadlift or a squat from the pins, or some other quarter squat variation, plus a really fast plyometric, whether that's a depth jump, continuous hurdle jumps, band assisted jumps, like whatever you may like, but some sort of contrast between those two are usually pretty nice. But I think having a way to measure that you're actually getting the effect you want from that, like you might be trying to do this to potentiate somebody, but can you get feedback that that's actually working? So having them do a vertical jump with a just jump mat or something to measure the actual output, to tell you set 1 was this, set 2 is this, set 3 is higher, et cetera, or are you just assuming that that's what's happening? I think also giving feedback to the athlete makes it a little bit more fun, a little bit more competitive too in the session.
Cool, great. Love that. So if you're like doing something like collecting the numbers, are you gonna do it like every set and every time you train?
Yeah, that's a great question. I think it has to be logistical and efficient and has to make sense in your space in that session. But I think oftentimes what we'll do is like, maybe that would be our main power block, right? It might be like something on the Kaiser, like the Kaiser power squat, where they're moving it at a strength speed or heavier load. And then they're going to come off and hit a hurdle hop to a vertical jump. And everybody's going to hit that for 4 sets, 3 sets, 5 sets, whatever it is. And we're going to get measures and outputs on that, because then the whole group is competing. Not only are they competing on the power output on the Kaiser, but then they're also competing on the vertical jump number. And so it really just drives the intensity and the intent of the whole session with the whole group. But like, obviously I'm not going to do that if I had 1,000 athletes. It just doesn't make sense. It's got to make sense for the session flow and make sure nobody's just standing around just trying to collect a number.
So oftentimes, like, how many athletes do you have like per session?
Yeah, it kind of depends. Like in an average group, I would say it would be anywhere from like 10 to 15 range, probably no more than like 15 to 20. That's a lot, especially for like a higher level group. That's a lot of people. But it also depends on the number of coaches you have. If you have 3 or 4 coaches for that session, then you can maybe get away with a little bit more athletes in the group. And also, how much equipment do you have? Do you just have one jump mat, or do you have 3, 4, etc.? So, if you have multiple tools and multiple coaches, you can adjust that number for sure.
Cool. So we've been talking like increasing the vertical jump. Is increasing the vertical jump going to like enhance their performance on the court?
Yeah, that's a great question. I think that's a big question like everybody's thinking about, because force plates and all of these things are so big in our industry right now. And I think technology is just going to keep being a big thing, and it's obviously really good, but like, is that relevant for everybody's goal and sport? Like, I don't know if it is or not. And I think that's definitely something you have to ask yourself as a coach and with that athlete and their goals and what they're telling you, because I think it's well intentioned and all what we're doing and everything, like, how do we measure the strategy an athlete uses to create and produce force at fast speeds in a consistent way? And also, how do we collect data on like those qualities in a consistent way? And I think a vertical jump is an efficient and effective way to do that. But is the goal just to improve the numbers, just to say the numbers are improving? Or is the goal like better availability on the court, or, a higher shooting percentage or something like that? That's a little different, maybe a little more skill based, but things that we can control from a performance perspective, maybe it relates, maybe it doesn't. And I think that just comes back to an overall assessment and like understanding where the athlete is at in their career with their goals and with their overall development, and figuring out what is the biggest variable that we can adjust. Is it body comp? Is it strength? Is it the vertical jump? Is it just getting healthy? All of those things are definitely a factor. So
cool. I kind of want to like go back to like you mentioned like force velocity curve, and when you mentioned that, you said probably one of the athlete, like he's like been training like sprinting, jumping a lot of plyo for a month, and you're gonna be exposing them to strength a little bit more. And if the athlete's gonna be if the athlete's been doing like heavy strength, or like Olympic lifting a lot, you're probably gonna expose them to something like more towards speeds, right? So if you like separate these to like different, let's say for a month you do strength, and for a month you do plyo, is that going to like also going to like increase their, let's say, like vertical or their speed?
Yeah, I mean, so that's a great question. Like, I think if vertical is going up, they're able to produce force relative to their body weight and be able to do that at a fast rate. So you might see both up, but it depends on how you're measuring it, I suppose. Is it going to improve their 40-yard dash? Maybe not. Maybe it will, but you probably want to run some 40-yard dashes and hit some sprints as opposed to just jumping to do that, right? So I think the big key there is like, depending on the time of year and depending on how much time you have with the athlete, sometimes training away from their strengths is where you can find really big improvements, especially in a short amount of time. But also, they have their strengths for a reason. Like, their strengths are what make them gifted. And so at some point, you need to also go back and make sure that those systems and those things are really robust and performing at a high level as well. So, it might start training away from what they're really good at, but then as the off season progresses or as your time with them progresses, maybe you go back to doing what they're really good at and then send them out the door back to their team or whatever they may be doing. So, but overall, I think you just have to have some way to assess that. What are you determining improved speed, and like, how are you gauging that progress? What are you determining improved, strength, power, whatever, and just track it over time, with whatever interventions you're doing. I think that's the biggest thing. We might put out a program for 4 athletes. It might be the same program, but not all of them respond the same way. And so, you just have to fine tune and tweak and adjust based on the feedback you're getting and how they're responding.
Cool. So, like you mentioned, like force plate, right? And I think it's like 4 or 5 years ago, I've been to Exos, Arizona. And at that time, I think there's not a lot of like coaches there use force plate, right? But since 2 or 3 years ago, you guys combine force plate with your training, right? So when it comes to like testing and using like force plate, especially for like vertical jump, is there like certain metrics you're gonna be looking at?
Yeah, that's a great question. So yeah, we just got the force plates in earlier this past year. So we've had them for around a year now. And I think really this year has been a ton of like learning for everybody. And so I'm definitely by no means an expert in like this whole space, and it's still something we're learning with and growing with. But in general, I think we try to look at metrics that kind of bucket them into eccentric qualities, concentric qualities, and then overall like elasticity or reactivity qualities, something like an RSI. So if I had to give you 3, maybe it's concentric peak power relative to body mass, eccentric peak power relative to body mass, and then an RSI or a mod RSI, depending on what you want to look at, whether it's just in the counter movement jump or in like a hop pogo type test. And so really from there, we're just, again, trying to take everything else that we've seen from a nutrition, from a rehab, from just a conversation with the athlete and their goals, and figure out, where can we best improve this athlete's performance. But that's just another tool also. And I think there's other ways to do it, even if you don't have those. But I think force plates are probably going to be a bigger role in our industry as we continue to progress. And so getting comfortable with them is probably a good call. And I think the more I learn about it, the more I feel like nobody really has like, this is the answer, right? Like, just like everybody wants to know what is the program, like nobody knows what is the metric. Like, it just depends on what you're trying to measure and what is relevant for that athlete in front of you. And so really, I think the force plate is better to be like, I have this question about this athlete's performance, and that is a way you can objectively, consistently measure qualities. And then you can track it and like kind of support your thoughts as a practitioner, as opposed to like just following this thing blindly.
Cool. I love this. So it kind of, I don't want to use that word, but it kind of doesn't matter which metric you choose, but just choose one and like just following that as you progress with the training, right?
Yeah, I mean, you know, I don't know if I want to say it doesn't really matter, because obviously it's going to matter at some point. It just depends on what the goal is. And I don't think there's like a specific metric that you always have to track. You know, jump height is probably a really good one to track, but it also depends on what you think is important. Like, is the athlete coming off an injury? Okay, maybe in that situation, maybe it's like his ability or her ability to hit the brakes fast and symmetrically. Or maybe it's just overall like they're just not super reactive, and maybe it's coming off an Achilles tendon problem and they just cannot do a single leg pogo well. Maybe I want to make sure that they have an efficient ability to use a stretch shortening cycle and have, you know, effective like RSI. So it just depends on what the goal is. And I think, you know, asking a question and figuring out what variable you can track to answer that question is probably the best way to approach it.
Cool. So the next thing I want to talk is about like deceleration. I noticed in your Instagram you post a lot of like decel, right? So when we train deceleration, is there like plyometric, when we're gonna introduce decel, is there like certain things you're gonna start with?
Yeah. So, you know, I think, you know, one thing I'm kind of posting a ton about is really like introducing it in rehab, and like, how do you take somebody from injury back to this? Because that's oftentimes missed in rehab, at least in the States. And I think that's a critical piece. Like, if you are saying an athlete is clear to return to sport and they haven't actually demonstrated effective change of direction, which is deceleration and then reaccelerate in an opposite direction, then like we're kind of missing a huge step, in my opinion, to be like, hey, yeah, they're safe to return. Whether that happens with you as a PT or that's you working with a performance coach or something, like at some point it needs to happen for them. And so I think that's a huge piece that is missed. And that's why I talk a lot about it. But introducing it, I think it depends on the situation. So if it's a rehab context and they're coming back from injury, I think, you know, you have to look at the specific area that was injured. Is it ankle? Is it hip? Is it knee? Or is it something else? In the case of the knee, vertical deceleration forces are usually less stressful than like a horizontal decel force. And so the knee is going to take a large portion of horizontal decel. And so making sure that they are prepared for that from a local tissue standpoint, just in the weight room first, is super important. And so you would argue that starting is just like good, solid strength training. But if you're talking about actually introducing like, hey, absorb force, usually I'm starting vertical. And usually it's something super simple, like just stepping off of a box, or like a drop squat where they're starting with their feet together and just dropping into a bottom squat position. And that could be done in a low amplitude situation, like in a pool or on a shuttle, or assisted with bands, or that could be in an overloaded situation where it's like with a weight vest or a higher box or whatever it may be. And so you start somewhere in there and make sure they can absorb force. First symmetrically, like obviously 2 legs, and then gradually to 1 leg, and then you increase the demands, whether that's speed or direction, changing it from vertical to horizontal, etc. But usually I'll start with some like pre-plyo type variations, different jump variations, and then I'll progress it to more slower like movement scale type variations.
So, you notice that like movement skill, what exactly is like the deceleration movement skill?
Yeah, so, I think if you look at somebody like sprinting in and going to change direction, there's really like three kind of key critical things. It's like the third to last step, the second to last step, and then the last step. And so making sure that they have an appropriate strategy, efficiency with that, and can like stop their mass and momentum efficiently is going to be key. And so maybe it's something like start 5 yards away, sprint towards this line, and then stop on this line as fast as you can. Like maybe that's a super easy way to start it. Maybe it's just walking. Like maybe you're just having them 3 steps and then hit the brakes and just at a walking speed. Or maybe it's even just like them standing and then dropping into a lunge position really fast. So there's lots of different ways to do it, but I think of like, what are the demands of the sport? In basketball, obviously there's a ton of sprinting, decel, cutting. And so they need to be able to do that from a large variance in movement directions from the side, front, back, etc. And I just try to start with a simple way and expose them to all the demands prior to them leaving rehab.
Cool. So, you mentioned that in the state, there's probably not a lot of like coaches or like therapists do decel, right, from rehab to like getting back to the court. But if we looking deceleration as a performance coach, is there a certain like how do you train it?
Yeah, so I think number one, you have to have in terms of how you train it, you have to have good eccentric strength and fast eccentric strength. You have to be able to apply force quickly. So rate of force needs to be key. So if we're going back to our force plate conversation, maybe you look at something like eccentric decel RFD. How quickly can I hit the brakes? And then maybe you track that metric over time to suggest that you're improving it. And then from there, I think it's coming down to like, what do they have to display? Do they have to display straight ahead deceleration, whether it's running at something, or is it like backpedaling, like a DB in football has to backpedal and then stop and then approach the receiver? Or is it, something else like side to side? So really it's just about being able to stop your body weight and then redirect it. And so good eccentric strength, really overloading eccentrics from a plyometric perspective, if that is the deficit. Maybe it's dropping from a high box and trying to stop themselves quick. Maybe it's using a band and overloading the deceleration mechanics, like you put a band around them and pull them into the cut. But I think if I had to lay it out simply, I think you have to make sure the athlete has the qualities that they need to be able to decelerate: eccentric strength, eccentric rate of force, overall technique in stopping. Like basketball, for example, they'll close out with 2 feet in like a jump stop. They'll close out in like a lunge position. They'll close out or stop from a backpedal position. So like, excuse me, you have to address all of those. And sorry about that. But once
No worries, man. No worries, man. No worries.
It's killing me. My bad. All right.
No worries, man.
So make sure you have the qualities first, right? Eccentric decel, eccentric RFD, and then expose them to the appropriate technique, whether it's 2 foot stop, 1 foot stop, etc. And then you got to train it. You got to overload it, make it faster, make it heavier, whatever it may be.
Cool. Love that. So, we talk about like last time we talked about like speed training, and earlier our conversation we talked about how like jump higher and run, yeah, jump higher and the testing, that kind of stuff. So and now we talk about like deceleration. So when we train our athlete to like jump higher, run faster, there's gonna be a lot of athletes there's going to be complaining about like how their knees gonna pain, how their Achilles tendon is gonna be sore. So when it comes to like tendon pain, how do you deal with these kind of stuff?
Yeah, so I think the biggest thing as a coach is like making sure you have a therapist or somebody that you can trust who can do an evaluation to say like the pain is just from whatever variable, training load, training frequency, strength deficits, whatever it may be, and that it's safe for them to continue to train, and like they'll probably give you and hopefully would give you specific parameters and modifications. If we're saying that it is for sure just an irritable tendon for whatever reason, key ways and key things to consider would be the volume of their training, the frequency of their training, and what it was like prior to this, recent onset of training or whatever it may be. Like, was there a sharp increase in training? Was there a period of where they weren't training? Things like that. And then really, if it is purely like tendons like load. Tendons adapt under load and they need strain. And so, people will talk about isometrics, eccentrics, whatever, but at the end of the day, like it just needs to be loaded and it needs to be progressively overloaded. And so isometrics are a great place to start because you can control a lot of variables. You can control the range of motion that's occurring in, you can control the effort, you can easily control the amount of work or total time under tension. And so that's a super simple place to start. And a lot of times isometrics will have an effect where it decreases somebody's pain. And so it might hurt initially 3, 4 out of 10, whatever. And by set 2, 3, 4, it's a 1 or a 0. And so sometimes leveraging a technique like that can help you get to some more training and help continue to build volume and adaptations there, but not always. So you want to make sure you're working with somebody who can actually like guide you on that a little bit. But load is the name of the game. So whether it's isometrics, eccentrics, another common technique is like a heavy slow resistance. So where it's like moderately heavy loaded and it's just controlled tempo, controlled concentric, pause, controlled eccentric, like just kind of working through that range. And so any of those strategies can work. It's just how irritable, what's like the level of the athlete, what can they tolerate?
Cool. So if we're talking like if it's for physical therapists, how do you assess that it's a tendon problem?
Yeah, great question. So I think there's a lot of things like, as a therapist, I don't get to see the structure. I don't get to know like, yes, it is 100% the tendon that is causing the pain. As a therapist, I get to look at a lot of variables, their complaints, their thoughts, their past history, their experiences with the pain, but also like more objective things like range of motion, strength, various strength qualities. And I think, pain is so complex, like we don't really have a solid answer on it, but we know that all these things are playing a role. And so as a therapist, you just have to critically analyze the situation, critically think about what's happening in front of you, what has been going on, how did it start, is it getting better, is it getting worse, what things aggravate it, what things improve it. And just try to find, again, just like training, like we might look at a vertical jump and be like, hey, he's low squat jump, really high counter movement jump, he needs strength training. Okay, rehab, they might look at something like that and say, well, he lacks range of motion. He also lacks overall strength, and he can't use a stretch shortening cycle efficiently at the Achilles or at the ankle. Those are three variables we might start to target to address symptoms of like something like an Achilles tendonitis or tendinopathy or whatever it may be. So really it's just about doing that evaluation and trying to find key things that you can adjust, and then just track whatever is significant, symptoms with jumping, symptoms with running, whatever it may be.
Cool. So is there like, let's say, if it's for like Achilles tendon pain, and is there like certain things you're gonna do as a therapist?
In terms of like a treatment?
Yeah.
Yeah, so like I said, I mean, obviously it's going to depend on the person in front of me and the situation, but I can almost guarantee you there's probably some loading that's going to happen, whether that's isometric, heavy, slow, or eccentric based. And at some point, depending on the severity and like irritability of it, how angry it is, we have to get them back to doing things fast. They have to be able to use a stretch shortening cycle fast if the end goal is something like playing basketball, something like playing any sort of field or court sport. Is going to require a lot of stretch shortening cycle and a lot of elasticity at the tendon. So it's like you can't just do strength. You have to also take them back to expressing force quickly. And so you might start all the way over here with isometrics, but then at some point, as their symptoms improve and as their function improves, you have to take them back towards what they're doing. And then also there's a whole conversation around like, well, you need to maintain other qualities. Fitness needs to maintain, like strength needs to maintain, and other areas. So that's where like working with another professional, like a strength coach or a performance coach, is critical for both professionals and the athlete, because you can't just do everything. So it's nice to have somebody that you can work with on either side.
So it's nice to have you on best of both worlds, right?
Yeah, something like that. Really, it's just, I don't know, it's just understanding principles. I think, I don't always have to be on both sides. If anything, I think it helps me see the lens that a therapist has to deal with. I get to understand the constraints of a therapist, and then I also understand the constraints of a coach. So, but that could be two separate professions. It doesn't have to be the same person.
Cool. So I'm gonna ask a stupid question. You mentioned that like ISO in when it's for like strength coach. You also mentioned that ISO when you're a therapist. So if I want to load the tendon isometric or like eccentric, it's stupid, but I'm gonna ask anyway. How heavy would you go?
Yeah, so that's a great question. So I think, with the literature around like tendon adaptation, it has to be at least like 70% of like their threshold or like maximal load. So, that's oftentimes like maybe a missed point. Like it needs to be relatively heavy, and the tendon needs to undergo a lot of strain to force adaptation. And so, how do you know that? How do you know what that 70% is? A lot of like handheld dynamometers or like crane scales or whatever it may be to measure force output. The force plate, you can set it up to where you can do an isometric on there and see how much force they're putting into the plate. But you just got to make sure you have a really clean and consistent setup, and like constrain the athlete to do the task you want them to do, because it's really easy to get a ton of noise and like they change their body weight, change something one way, and they get a totally different output. And so, yeah, 70% for isometric is kind of the number. It needs to be at least 70 or higher.
70% of their power,
like their total force that they can put out.
Cool. Appreciate that. So, yeah. Last thing before I go, okay? I really enjoy our conversation, and to be honest, I learned a lot from our last conversation, and I learned a lot from today. So if there's like coaches are interested in what we're talking about today, where can they reach out to you?
Yeah, the best place is probably Instagram. I'm the most active on there. So the handle is just Keegan, KEEGAN _ Ross, ROSS _ DPT.
Cool.
And yeah,
Appreciate it.
Eric, I appreciate you having me back on, man. It's always good to talk to you. The first one was good. This one was good. So thankful for the opportunity to come on, man. Appreciate you.
Yeah, appreciate that.